Good afternoon, everybody. Thank you for joining us today. It is with sadness that I have to confirm this afternoon the death of one more patient in Scotland who had tested positive for coronavirus. This means that the total number of deaths confirmed in Scotland as of now is 3. All of our thoughts are with their families, and we once again thank the NHS staff who continue to care for all those who are suffering from this virus. In addition, I can confirm that as of 9 a.m. today, there have been 227 confirmed positive cases across Scotland. The further detail on the breakdown of that will be published as usual at 2 o'clock. As the Health Secretary set out yesterday, our NHS has now been placed on an emergency footing to ensure that it can prepare as well as is possible for the challenge that lies ahead. ICU capacity is being doubled, more staff are being trained in ICU skills, general hospital bed capacity is being increased, and our normal programme of non-urgent elective operations is being suspended. However, I do want to stress, as the Health Secretary did yesterday, that essential health care such as cancer treatment, emergency care and maternity services will continue. The Chief Medical Officer will be happy to answer any further questions on health issues in a moment. Let me repeat again the advice we are urging people across the country to follow. If you have a fever or a persistent cough, stay at home for 7 days and stay as isolated from the rest of your household as possible. If you are in the same household as someone with these symptoms, stay at home for 14 days. And for everyone, especially those over 70, people of any age with health conditions for which you get the flu vaccine, and pregnant women, cut down social contact as much as possible and stay away from crowded places like pubs, restaurants and cinemas. In the coming days, contact will be made with those who are most vulnerable, for example, those with compromised immune systems, offering tailored advice and support. The actions we are asking people to take are unprecedented, but I want to be very clear again today that they are necessary. They are about saving lives, protecting the population as a whole and safeguarding our NHS. But these actions will clearly also have a significant impact on our society and on the economy. People around the country are adapting to a new way of life, and I am determined that government will do whatever we can to reduce the challenges that come with that as much as possible. So I want to refer to 2 further packages of support we will be announcing today. More detail will be provided to Parliament this afternoon. Firstly, for business, we have already made available a £320 million package of support, primarily for small and medium businesses and the hospitality industry. I can confirm that following the Chancellor's announcement yesterday, the Scottish Government will announce further measures to support the economy. This package of further measures will be worth £1.9 billion, and that will involve every single penny of support flowing to Scotland from the Treasury announcement being passed on to businesses here. The Cabinet Secretary for the Economy will make a statement to Parliament this afternoon, setting out the initial plans for that. But of course, we know that it is not just businesses that will be impacted by the challenges ahead. People's way of life will be changing dramatically and potentially for some time to come. For many people, that will put them in a very vulnerable position, both financially and socially. Lives are being disrupted like never before. That will cause financial hardship and could impact negatively on people's well-being, particularly mental well-being. Therefore, as part of our efforts to support people and communities, not just businesses, to meet the challenges that the virus will bring, I can confirm that the Scottish Government will this afternoon set out a £350 million package of welfare and well-being support for people impacted economically or through reduced contact with wider society. That package will include increased support for the Scottish Welfare Fund, support for council tax reduction to help people meet bills, emergency funding for local authorities and significant support to ensure that those on low incomes can continue to access food. This morning I visited Age Scotland, who will receive additional money to expand capacity on their helpline that provides support and advice and sometimes just a friendly voice for older people. The work they do in the coming weeks will be vital, and I would hope that newspapers and other media outlets will help us by making this number widely available, 0800 12 14 222. We're also making available a significant package of support that will put money behind the community effort that we are seeing flower around the country. I want to be clear, where people stand ready to help each other, this government stands ready to help you. We will also be producing adverts and campaigns highlighting not just the vital health advice we are giving, but also how people can help each other and ways in which people can cope during the periods they are spending at home. Let me turn now and finally to the issue of schools and nurseries. On that, as on everything else, I want to be as open and transparent as possible. My view is that it is now inevitable that we will close schools and nurseries. And my planning assumption now is that schools will close to pupils at the end of this week. And I wanted today to give parents notice of that now. There are two key drivers of that view. First is the science. SAGE, our expert scientific advisors, are examining new advice literally as we speak. I expect that is likely to tell us to close schools. Secondly, we have the reality on the ground. As people do the right thing and follow the advice to self-isolate or to isolate as a household, more and more schools are approaching a point where they have lost too many staff to continue as normal. We are working closely with schools and tomorrow the Deputy First Minister will set out in a statement to Parliament the arrangements we are putting in place. In particular, he will address key questions that I know parents, pupils and teachers will have, including what this will mean for vulnerable pupils, those receiving free school meals, because we must not cut adrift vulnerable children. Secondly, what this means for pupils taking their exams this year, because we will not blight the life chances of our children. And crucially, what this means for key workers. We must ensure that our doctors, nurses and other critical staff can still work. Lives are on the line if they cannot. I want to be open with people that we are still working out all of the fine detail of what exactly this will mean. It is important to know that there will doubtless require to be a lot of local flexibility required, and while we will set out maximum detail tomorrow, planning with councils is likely to go on well into next week. In some areas, private nurseries and childminders can play a massive role in helping key workers keep going. In other areas, councils will use school buildings to reach vulnerable children. We will support any and every plan that helps people make this work. And to reassure teachers and all school staff, as well as those in the nursery sector, we will work with you in the coming days, because other than parents themselves, we know that you know children best. And we know you will step up to help because we know how committed you are to the children you teach and those that you care for. There will be a vital role for teachers and all school and nursery staff in the weeks ahead. Finally, on the question that I know parents and the wider public will have of how long this will last, the clearest guidance I can give now is that people should not assume that schools and nurseries will reopen after the Easter break. We will, of course, only keep them closed for as long as we absolutely have to. But at this stage, I cannot promise that they will reopen before the summer holidays. Let me say that this has been one of the hardest decisions we have faced so far as we tackle this virus. We know that this will massively disrupt life, society and the economy. We know that it massively changes family life, and nothing is more precious than that. But that indeed is the measure of how serious this virus is and how serious the challenge is that we face. Finally, I want to thank everyone across Scotland for your patience, your understanding and your cooperation. We are heading into stormy waters. Of that, there is no doubt. As your First Minister, I will do everything I can to steer the ship safely through, but I do need your help. It will not be easy, but together we will get through this. Thank you very much indeed, and the Chief Medical Officer and I are now happy to answer any questions that you have. Colin.
What has changed in terms of the guidance that you're being given, the scientific guidance, in terms of the schools?
I'll hand over to Catherine in a second to cover the point on science in more detail. SAGE is looking again, I understand, today at the scientific position. We will receive that advice later. My strong expectation is that that advice will move in the direction of advising school closures, and that is clearly important given the approach we have always sought to take of following the scientific advice. But as I said in my statement, what is also changing on a day-to-day basis is the practical reality on the ground. People are doing the right thing, in my experience so far, of self-isolating when they have symptoms, of isolating whole households when that is the advised course of action. And with every day that passes, that means there are fewer teachers able to staff our schools, and that is entirely understandable. There are more children who are not at school for the same reasons. So there is a mix of science and practical reality involved here. I do repeat what I said earlier on about this being a really difficult decision and a really difficult judgment to get right. I've said all along that we would take this decision when we judged it to be necessary, but we have sought to keep schools open for as long as possible, for the well-being of children, for the resilience of the key workforce, and also because we have always known the likely duration of a closure, and therefore being very keen that it did not have to happen earlier than was necessary. But I'll hand over to Dr Calderwood, who will perhaps say a bit more about the scientific position.
The Scientific Advisory Group for Emergencies has been advising the 4 Chief Medical Officers across the UK for some weeks, using the data and the modelling that you have become familiar with about social distancing measures, for example. The closure of schools has always been within that modelling, because we wanted to understand what impact that would have both on the transmission of the virus, but also impact on the capacity of our NHS to deal with this epidemic. The timing of those school closing measures has really been held off as being something that we did not want to do. Nobody wants to be in this position of this announcement that we have made today because of that huge social disruption, and also because of that protection of our workforce and our protection of vulnerable children. So this was always going to be a measure that we took very seriously, but much further on in our epidemic numbers. The real change, actually, Colin, is the fact of that rapid acceleration of numbers of cases. That's very clearly seen in the numbers in England at the moment, particularly around London. But we have 227 confirmed cases in Scotland today, and I'm afraid that that is a significant underestimate. So that cusp of acceleration of the virus led us to introduce the measures that you heard earlier about people self-isolating, households isolating, and social distancing. And this closure of schools is another measure which we know will enable our NHS to best keep the capacity for people becoming very sick, but also will prevent further transmission of this virus.
First Minister and Chief Medical Officer, thank you very much. You said that it's imperative that nurses and doctors can continue to go to work and lives are on the line. There is a whistleblower in the Scottish Ambulance Service who is speaking to ITV today, saying that lives are being put at risk because they are not being given the protective equipment that they need. They say that they're being given flimsy paper masks, that they're being asked to share personal protective equipment, and that they have not been able to get a replenishment of hand gel sanitizer for the last week.
Can I say very clearly to any member of our frontline health workforce that I want them to be as protected as possible. We are working incredibly hard to make sure that the protective equipment is there, that is distributed centrally to boards and boards distribute it on. The Health Secretary, which you may or may not have heard, covered the issue of the Scottish Ambulance Service in the Scottish Parliament yesterday. And I would say, and I mean this sincerely, to any member of the frontline health workforce, if they feel they are not getting the support they need, they can come to government confidentially, they can come to the Health Secretary or me. We will do everything we can to address those concerns and make sure that the right support is available. We are all absolutely, and nobody more so than me and the Chief Medical Officer, given her leadership responsibility in the medical profession, we are absolutely acutely aware of the importance of protecting those who will be working so hard to protect the rest of us. So if somebody is, as you described them, a whistleblower, no doubt they've done that under conditions of confidentiality, but if you're able to provide the detail of that, I will ensure it is addressed today.
One thing they did say, First Minister, is they have been raising concerns. They've been saying that this is a problem.
Peter, can I say to you in all sincerity, and I've said this before, I absolutely respect, as I always do. I don't always find it easy, but I respect the scrutiny role that the media has in this, and I respect, and I said this in Parliament yesterday, the vital scrutiny role that the other parties have in this. This is not a normal situation. We are all working at pace. We are all dealing with difficult issues in an unprecedented situation. We will not always get things right, and when that happens, we want to rectify it as quickly as possible. Everybody is acting in utter good faith right now, trying to do the right thing. So I say in all sincerity, if these things are brought to my attention, I'm sure the Chief Medical Officer will say the same. We will work to rectify these things as quickly as possible. I don't know, Catherine, if you want to add anything.
We've had concerns flagged from not just the Scottish Ambulance Service. We realise that the supply of masks, the correct masks, there has been some further work done with guidance as to which healthcare workers during which procedures need which types of masks. We are addressing it. There are more supplies in train. I would absolutely echo the First Minister that we want to protect our frontline staff.
Can I say, one of the things that was always became very obvious to me when I was Health Secretary, and it has stayed this way, there's very, very few people in Scotland, and I include myself in this, who doesn't have a family member working in the National Health Service. We all know the pressures they work under all the time, and I take very seriously the obligations of the Scottish Government and the Health Service generally to protect those frontline workers. So we will continue to hear concerns and address and rectify concerns as quickly and as effectively as we can. Yes.
With the rapid acceleration, you go. With the schools closing at the weekend and this rapid acceleration of cases, how far away then are we from a complete lockdown?
Well, I'll pass to the CMO in a second on that. One of the things that we've been discussing this morning is we have been rightly seeking to take a four nations approach to how we tackle this virus, and that will continue to be the case. But the CMO will be able to go into more detail from a more expert perspective than I can, but it will not necessarily be the case that all parts of the UK are on the same point in this infection curve at the same time. We know London is ahead of the rest of us, so we may see more stringent measures than even those that we have announced so far being taken, but they will not necessarily be taken in all parts of the country at the same time. And that's one of the things we are working hard to do right now, is to understand at very granular level of how this infection is spreading in Scotland, so that the measures we are taking here are right, not just in general, but are taken at the right time as well. And we will continue to monitor that data very closely.
So Lisa, we're definitely not at the stage of needing lockdown measures in Scotland at the moment. That the numbers are increasing here. Our community surveillance does show us that there is some sustained transmission within the community in Scotland, and obviously with our enhanced monitoring in the community, we will have more information this week, next week, the coming weeks. The numbers at the moment, though, are not in any way concerning that lockdown would be necessary. The measures we've put in with the addition of the schools, this will slow the transmission of the virus and enable our NHS capacity to be built up. We will look at the data for Scotland. All of the modelling that we've done has specific Scotland data within it, and therefore we will take decisions at different times across the UK, depending on that spread of the virus. And it's absolutely to do with the numbers and the clusters and the geographical areas.
I think that's something quite important to understand at this stage, that we may in the weeks to come see different measures being taken in different parts of the UK at different times. But what I want to stress is that that does not mean we are taking a different approach. It simply means that we will be at different stages of the spread of the infection. Mark.
Mark McLaughlin from the Times, really one for the Chief Medical Officer initially. I heard what the First Minister said yesterday about the resource implications of mass testing. Is there any clinical advantage to mass testing, bearing in mind what the World Health Organization said, test? And also, we are testing 1.2 million people, but it's still unclear whether these people will be told if they are positive or not. Is that going to be the case? And what would you say to someone? Say, we're going to test you, but we're going to leave you hanging, basically.
So I'll correct your point about the testing of 1.2 million people. The GP practices who will be doing community surveillance cover a population of 1.2 million, so around a fifth. That does not mean everyone within that population will be tested. It's people with the relevant symptoms who are coming forward. There are ongoing discussions, in fact, about actually having that anonymised community surveillance, but adding further testing where people will be told if they have a positive diagnosis. That's not in place yet, but that's a further step that we will take in the coming days and weeks. We want to have as much information as possible. So our robust Sentinel GP practice surveillance continues. Everyone who's admitted to hospital with respiratory symptoms or a fever or other symptoms suggestive of COVID-19 will be tested, will have that test result reported to them, and will have contact tracing of their relevant contacts, who would also again be tested if that was necessary. For key frontline workers, they are our priority. And what you need to understand is that in the UK, we have the best capacity for testing almost anywhere in the world. So we have the ability to test more people than per head of population than other countries. However, with the numbers as they increase, our lab capacity cannot keep up. It does at the moment, but it will not by the time we're having tens of thousands of people being affected every day. And it would not be able to be tested not just in Scotland, but across the UK. So that's why that sampling testing, where that's a community-based, and then we extrapolate up for the numbers in the population. However, very live discussions at the moment are to rapidly introduce new types of testing which would look at antibodies produced to coronavirus. That would be hopefully a very simple dipstick test. It's not available yet. We're in early discussions with commercial companies about producing that test, and that would allow that mass testing that you're talking about, but it doesn't rely on laboratory capacity. People would do it at home with a simple kit, and they would have that information as to whether they have positive antibodies, therefore had coronavirus, could go back to work and not isolate themselves, or whether then that testing needs to be repeated, which would be our eventual aim. We may end up asking people to take these tests several times.
Just a follow-up, if I may. I misunderstood that one.
That's all right.
Do you have a target of how many you want to test on a weekly, monthly basis?
We want to test as many as possible, and we want to have that lab capacity as the one. That's what we've got at the moment. That's what we're familiar with. Adding these other types of testing, as I say, literally have come from a meeting before this press briefing, which discussed some of these innovative new ways of testing, which are not the swab-based testing, but they're actually looking for antibodies to see that you have had coronavirus.
Okay. Yes.
Tim Maxwell from ITV Border. You've spoken before about your reluctance to close schools because of the growing impact it's now on so many people. What are you trying to do to mitigate the impact on them?
Well, I covered some of this in my opening remarks, and the Deputy First Minister, who, of course, as you know, is the Education Secretary, will set out more detail of this tomorrow in Parliament. We are working very closely with COSLA and local authorities. Effectively, we're focused really on three things: how we continue to support vulnerable pupils, particularly those who rely on free school meals, because we want to still have the ability of making sure that those young people get the hot meal that we want them to get. Secondly, how we will address the issues with the exams this year, young people who are sitting exams and perhaps at the final stages right now of completing coursework. And thirdly is the point that has been raised before, how we can put in place arrangements that provide some kind of support and care for children of key workers in particular. Those discussions are ongoing. John Swinney will set out as much detail as possible tomorrow, but as I say, it is likely this planning will continue for some days. I also would say, and I think I can say this without any doubt, that there will not necessarily be a one-size-fits-all across the country. Different local authorities will have different arrangements depending on their circumstances. We've seen already in Scotland this week with schools in Shetland being closed, obviously a particular kind of community, and the arrangements they've put in place to meet these objectives may not be right for Glasgow or Edinburgh. So there will be a lot of local flexibility here, but those are the issues that we are seeking to address as a matter of urgency. Yes.
Michael Blackley from the Daily Mail. If there is a sustained and long-term closure of schools, will it be an option at all to repeat the entire school year?
Well, I don't want to get ahead of where our discussions and decision-making is on this. We want to, and I say this, and almost before I say it, I know that it will sound as if I'm underestimating the impact of this. We will want to minimise the impact on young people's education and the impact on young people's lives as much as possible, but that does not mean there is not going to be an impact. So the most immediate issue we are facing right now is about young people who are sitting exams and giving clarity as soon as possible as to what that means for coursework and the exam diet. We don't know yet. In all of this, the one question that is the most difficult thing to answer is how long is all this going to last? I don't know the answer to that yet. Hopefully we get more clarity on that as the data develops in days and weeks to come. I'm trying to give as much transparency as possible by saying people should not assume the schools will open after Easter and may not. That is not me saying they certainly will not open before summer, but I cannot guarantee that right now. So once we have got a better sense of how long this will last, then longer term decisions, of course, may fall to be taken. But we are trying to work through this in as ordered a way as possible, prioritising the issues that really are most urgent in that order of decision making. Yes.
Now that patient confidentiality must be less of an issue, can you give us an idea of how many of the 227 patients are in hospital and how many have recovered?
Obviously this data on a daily basis has to go through lots of verification. We'll continue to provide as much information as we can of that. We provide a breakdown later on, but although 227 is a bigger number than single figures, when you break that down regionally, of course, there is still issues with patient confidentiality, so we have to be cautious about that. I don't know whether you want to add.
Yes, we wouldn't be saying anything more specific.
What you were thinking about maybe 20% needing to be hospitalised, or just to get an idea of where we are in terms
so
of
the numbers are too small at the moment, and we also don't have our full community surveillance available, so we will know more and be able to tell you more when we do.
And on a similar, can I just ask where we are in terms of the progress on the 3,000 new hospital beds and the 190 new ITU beds?
That is underway, and we will keep people updated on that. These are the mobilisation plan that we have for the country, the mobilisation plans that health boards are working to are in progress of being developed. That will be work that is progressing literally on a daily basis. The decision that the Health Secretary took yesterday to formally, under the NHS Act, place the NHS on an emergency footing is important because that, of course, signals the phase out of non-urgent elective work, which allows a much more firm and definite transfer of resources into the build-up of the capacity we are talking about. Okay, any
school meals that are provided to children in poverty, and what provisions will the responsibility lie?
I've addressed that in some length already. John Swinney will set out more detail. We're working with local authorities on that. Local authorities obviously are the statutory providers of education, although the relationship on these matters is by necessity a close one. There will not necessarily be a one-size-fits-all approach there. We are absolutely determined that we make sure we continue to provide food to children who rely on free school meals. But I think in Shetland they've been doing that through cash availability to families. Other local authorities may choose to do that in different ways, and that is the detail we're working through right now with local authorities. Okay, thank you all very much for your attendance.